I think it's a good time to go ahead and start. Um, Before I start, I just want to mention that everybody is muted right now. If you try to talk, I won't be able to hear you. I will save questions for the end. If you have questions, feel free to type those into the chat box, and we can address those at the end of the webinar. The talk should only be about 15 minutes. Yeah, so let's just go straight into it. This is with Backs in Action Rehab and Wellness Center. This is the very start of our webinar series, so it's super exciting. This one is an introduction to telehealth. My name is Ryan Takagi. I'm a chiropractor, also did a Master's of Science in Nutrition and a Bachelor of Kinesiology at the University of British Columbia. We have a few objectives for this webinar. So some things that I want you to take away. I want you to have a good understanding of what a telehealth visit looks like and feels like. I want you to know what the benefits of a telehealth visit are and some of the conditions that can be treated. Before we go into those, though, I just want to mention that the College of Chiropractors of BC, they've done a great job of responding to the current situation and making sure that we can still treat patients. So some of the telehealth services that they mentioned, so this is the A, B, C, and D points on this slide, are prescribing changes to therapeutic exercise programs, recommending modifications for supports and devices already in possession of the patient, or recommending over-the-counter devices that might be new, and advising and counseling on matters related to conditions of the spine, other joints, the nervous system, or the overall health of the individual. So into those points now. So what does a telehealth visit look and feel like? The good news is that there's a lot of similarities with our in-person visits. So we're still using Jane app. That's that picture here on the right. You can still book online, and we continue our therapeutic relationship. All right, so lots of good news here is that the visits through telehealth are very similar to our in-person visits. And so the steps to book yourself a telehealth visit, it starts with either booking online. And so you can go to the website backsinaction.ca, or you can call the clinic, or you can email the clinic at this address. After you book yourself an appointment, you'll be sent an email link to the video call. You just click through that link and we meet in the video instead of at the clinic. Keep in mind, though, the visits might take a little bit longer just because we are all still getting used to the new format, the new system, and sometimes there are a few technical difficulties. But overall, my experience has been that the visits are very smooth. Telehealth visits are combining practitioner guidance and individual self-care. So we're still taking advantage of empowering patients to take care of themselves. The visits are very similar. I'll be just as awkward online as in person, so that's the good news. Okay. When you're setting up your visit, there's a couple things you can do to prepare. Those things will be a bit different for the different practitioners in different disciplines. So obviously the counseling visit is going to look a little bit different than the physiotherapy visit. But when we're thinking about the movement practitioners, here are some things to help you out when you're setting up your first visit. You're going to want some space to move. So if you have that option wherever you're staying, giving yourself a little bit of space to move around is going to be really helpful. A video angle that allows us to see the full body is going to be helpful for us, or at least to see the body part that's affected. You might want an assistant for the video, so if there's someone else in the household that can help you, it's going to be really helpful for us, especially if you are in extreme pain. We're going to be asking you to move into different positions, and you're not going to want to also have to get up and shift that video around. So having someone else that can move the video around is going to be really helpful. Some weights or exercise bands, if you have them, are great. If you don't have them, that's also okay. The practitioners at the clinic are very good at coming up with other ideas. So we can use anything else around the household. But if you do have weights and exercise bands, having those ready is going to be great for us. So into the next point, what are the benefits of a healthcare visit? I just want to reinforce that our biggest value to you is our knowledge and not our hands. So something you might be thinking is, usually I go see my chiropractor or my physiotherapist and they do a lot of hands-on care. And that hands-on care is really important and helpful, and we receive a lot of training in that care to maybe help joints move better or to help muscles feel a little bit more relaxed. But our biggest value is our knowledge. So it is our brain and not necessarily our hands. And we can still guide you through exercises that'll help your joints feel a little bit looser or help your muscles feel a little bit looser. So we can guide you through some movements that'll help mobilize those joints. And that's going to help you feel better. I really like this quote from the Ottawa Charter for Health Promotion. So health is a resource for everyday life and not the objective of living. So we are still a health resource for you, and you can take advantage of us to help you live your life. You have a therapeutic relationship with us, and we know you. So there's lots of online videos right now. There's lots of clinics putting out free content. There's lots of free content on YouTube. And so you should still definitely take advantage of all of those videos, all of that content that's out there. But the reason you might use a telehealth visit or take advantage of telehealth is because we can tailor exercises for you and we can give you specific feedback. Okay, so that's going to be really helpful for both of us. And a really important point here is that you remain at home. And so we've all been receiving this message to stay home. That's been a very common theme. Staying home is important for population health right now. And at the same time, though, we want to make sure that your individual health is being taken care of. And so a telehealth visit is really directed towards your individual health and it allows you to stay home, which is for population health. For new patients, telehealth gives us a platform to develop that therapeutic relationship while allowing you to stay home. So don't wait until this is over because we don't know when that's going to happen. If you're feeling pain, then definitely take advantage of this platform and seeing a practitioner now, as opposed to waiting until you can go back into the clinic. And so you can stay home, but you can still get the care that you need. Another important point is that we have a clinic of practitioners with a broad range of knowledge and skills. So I am more than happy to refer people onto somebody who might have a different knowledge and skill set than me. And so if you book a telehealth visit at the clinic, those practitioners are going to be more than happy to add someone to your care team if they think it's needed. So this last point, if you have pain, you're not alone. We're here to help. Don't wait until this is over. Take advantage of telehealth right now. You can definitely see somebody through this platform and it works really well. So speaking of the practitioners at the clinic, here's a list of people that you can see. So chiropractors, physiotherapists, kinesiologists, and counselors all have a great set of knowledge and skills that can help you through this platform. So they can take advantage of telehealth and they can still help you out. On that last point in our outline, so what conditions can be treated? This is a simple answer. So all conditions that respond to treatment in the clinic can also be treated via telehealth. Education and exercise are great tools for just about any condition. So education and exercise are really the pillars of any rehab program. And we talk about rehabilitation. There's a great definition for rehabilitation, which is the amount of time it takes for you to have the skills and knowledge and tools to take care of yourself. So that's really what our goal is here with education and exercise. We want to give you the skills and tools so that you can take care of yourself. We're trying to empower you to take care of yourself. And telehealth is a really great platform for that. I also want to remind you that you don't need a condition to benefit from telehealth. Okay, this is a good time to build a maintenance plan together. Remember, we're just one of your health resources, one of your many health resources. So we're here to work with you to build your physical capacities. This is another quote from the Ottawa Charter for Health Promotion. To reach a state of complete physical, mental, and social well-being, an individual or group must be able to identify and to realize aspirations, to satisfy needs, and to change or cope with the environment. I think right now we're all coping with the current environment, and I think we can do that together. So this is a platform that allows us to do that together, and for us to work together to build your physical capacities. A question that you might have is, will my telehealth visit be covered by insurance? And the short answer is yes. So there's a few insurance providers that do cover telehealth appointments, and others are joining this list. And so at the Backs in Action Clinic, here are some companies that cover telehealth. So you can just read through this slide, but ICBC is part of it, WorkSafe, Sun Life, and a few others. But insurance companies are covering these telehealth visits because they're so beneficial. I just want to mention that this is the first webinar in a series of webinars. So there's going to be 3 more to follow, and those are going to be on April 30th, May 7th, and May 14th. The first one's going to be on fundamental movement skills within the constraints or affordances of your own home. On May 7th, we're going to talk about structuring movement into your day. And on the 14th, we're going to talk about lifestyle factors related to aging and longevity. Okay. So that's the total of this webinar for today, but I just want to remind you that telehealth is really important. It's going to help continue your care with your provider. So if you currently have a treatment plan with somebody, telehealth is a great way to continue that treatment plan. Okay, so it helps avoid any kind of regression during this pandemic. It allows us to continue to progress your exercises. It helps us build that stronger body so that you avoid injury. We can work on your ergonomic setup at home. And it's just one of those coping measures that we have to help lower the anxiety that people have throughout this time. Okay. So if there's any questions, you can type them into the chat box, or you can unmute yourself or ask me to unmute you and we can go through those. So there's a few questions that are coming through. The first one is, can I get access to TheraBands and weights from the clinic? The answer is yes. So if you're looking for TheraBands and weights, just send an email to the clinic and they can help set you up. So just you can call this number that's on this slide or send an email to the email on the right, and they'll help set you up with TheraBands or weights. Next question, can you take a new patient over telehealth? The answer to that is also yes. So there were some recent changes from the college that happened a few days ago to allow us to take new patients. So they're really doing a great job to allow us to continue to serve people. And so new patients are very much allowed to take advantage of this service through telehealth. If there's any other questions, feel free to type those into the chat box. Okay, so another question coming through is, are there any user fees for this service? So right now, there are currently no user fees. So we're waiving those fees for those who don't have full coverage with their insurance. Okay, so that's probably it for questions. Thank you very much for joining the webinar. If you're listening to the webinar, or if you're listening to the recording, thanks for tuning into the recording, and enjoy the rest of your day.